Hi, I'm Dr. Janis Holt, and I'd like to thank you for tuning in to the Ask Me Anything session. Today I'm going to be talking about diabetes and its effect on your vision and the questions that you might have related to diabetes. The first question that was submitted was, how is diabetes connected to my vision? And the answer to that is that the most straightforward answer is that high blood sugar ends up affecting your eyes, both in the circulation to the eye, but also blood sugar can compound itself in your eyes. And when it does that, it causes changes or blurring to your vision. So those blood glucoses that are 200, 220, and even higher than that, those are really affecting your vision. And then we tend to know that happens at blood sugars that are over 180. That way you have reached a point where your kidneys can't handle that blood sugar anymore, and you're starting to have effects on that throughout your body. What is diabetic retinopathy? Diabetic retinopathy is a change in the blood vessels in the back of your eye. And that change can cause leaky blood vessels. It can cause fluid to leak. It can cause blood to leak, protein. Those are things that can leak from blood vessels that have been damaged by high blood sugar. That number that they measure, that hemoglobin A1C, that's really an important measure, and that's why your primary care doctor may look at it often, even up to every 3 months. That hemoglobin A1C has another name. It's called glycosylated hemoglobin. In other words, blood glucose attaches to hemoglobin. Well, what's hemoglobin? Hemoglobin is that reddish iron molecule that makes your red blood cells red. And your red blood cells, which will circulate around for about 3 months, get this glucose attached to them. This is a silly example, but this is how I think about it. I tell patients that glycosylated hemoglobin, or that hemoglobin A1C, that stuff that gets that glucose attached to it, becomes a red blood cell with barbed wire attached. And that barbed wire bumps along through your arteries and veins, and it damages them. And it puts little nicks on the inside lining, and then they begin to leak. And when they leak, we can see it in the back of your eye, and it causes diabetic retinopathy. Can you make a change in it? Yes. By lowering your blood sugar, new red blood cells come into your system. They don't have that glycosylated hemoglobin, no barbed wire. And so all of a sudden, you've got these new, fresh red blood cells that no longer bump along and damage your blood vessels. And they have a chance to heal. And diabetic retinopathy resolves itself. Can diabetic retinopathy get so bad that all of a sudden the blood vessels can't repair themselves any longer? Yes, it can. And in that case, diabetic retinopathy can lead to blindness. But long, long before that, you have the opportunity to work on your hemoglobin A1C and your blood sugar, and you have a chance to reverse it. It's within your control. And that's the good news, is that we can spot this stuff and we can tell you this is leading in the wrong direction, and you have a chance to make it better. The next question was, I was diagnosed with type 2 diabetes. Is there a difference in how concerned I need to be about its effect on my vision versus other types of diabetes? All diabetes, all types of diabetes, are an inability to handle blood sugar effectively. All types of diabetes leads to changes in the eye. Some are more permanent, such as gestational diabetes, which is associated with pregnancy. Some are associated with steroid use, where you develop a transient diabetes because you have to use prednisone or something like that. But all diabetes result in a high blood sugar. And when we got that high blood sugar, the sugar attaches to the hemoglobin. The glycosylated hemoglobin, or the hemoglobin A1C, goes up. And now we've got barbed wire on our blood cells. And now we're causing damage to the blood vessel walls. So in a sense, it may be transient, but it is all going to have the same effect over time. What are some of the signs of diabetes affecting your vision? That's an important question. How would you know? Well, oftentimes the earliest sign in knowing that diabetes is affecting your vision is you have a transient blurring of your vision when your blood sugar goes up, because it's over 180. Your kidneys can't handle it anymore. And so all of a sudden the blood sugar is seeping throughout your body. And one place it seeps is into the lens of your eye. And the lens of your eye swells up a little bit because there's sugar in there. So your vision gets blurry. And it stays blurry for a while because it takes a while for that sugar to sort of seep its way out of your lens and for your vision to go back to normal. That's the most common sign. Other signs occur with loss of vision or constant blurring of your vision when that hemoglobin A1C has been high for quite some time. And in that case, now it's beginning to cause leaky blood vessels, which cause not just a transient change in your vision, but a long-term change in your vision. Can a young person's vision be affected by diabetes? Absolutely it can. Young people, just like anybody else, can have high blood sugars, and those sugars are going to cause changes in your lens and eventually will cause changes in your blood vessel walls. I have floaters. Does this mean that I have diabetic retinopathy? Maybe. The answer is maybe to that. So floaters oftentimes are just small pieces of protein that float around in the back of our eyes. We have them. We may even be born with them. We may get them as we age. But if a blood vessel wall is damaged and it starts leaking out little red blood cells, those can be floaters too. They look like floaters, but they're actually blood. And in that case, floaters and diabetes that is not well controlled may mean you have diabetic retinopathy. And you won't know until you have somebody check it. The next question is, I'm in my 30s and I was just diagnosed with diabetic retinopathy. Any advice on how to manage it and how to maintain my vision? Gosh, guys, I'm like a broken record here. Unfortunately, the thing that you can do is lower your blood sugar. Lower your blood sugar, work with your primary care doctor, work with a dietitian if that's something that will help you. Read. Make yourself knowledgeable about what foods may help you to lower your blood sugar, and what kind of medications might be an option for you in taking better care of your diabetes. So, yeah, if you're diagnosed with diabetic retinopathy and you are in your 30s, that's not a good sign. Because these days, we hope to live till we're in our 80s. And if I'm in my 30s and I have diabetic eye changes, I've got 50 years to make sure that I turn that around and I keep it on the right track. What are the top things to keep in mind for someone who was just diagnosed with diabetes? Well, one of the things that's really important is that most of the time when we're just diagnosed with diabetes, we've had it for a while. We just now finally got the diagnosis. So what you should know is I may have just been diagnosed with diabetes, but I may actually have changes in my vision or changes in my eyes because it's been there lurking in the background for some time. That's why oftentimes the primary care doctor will ask you, please get an eye exam. Please let them look in the back of your eye, and please let them tell us if there are signs of diabetes that's actually been there and been there longer. I tell patients, the eyes may be the window to your soul, but they're also a window to your medical condition, and they're certainly a window to your diabetes. Because without biopsying areas of your body, which is certainly nothing any of us want, I can look in the back of your eyes, and I can see the arteries and the veins. I can see other tissue that's affected by diabetes. And when I can see that, I know what's happening in your kidneys. I know what's happening in your fingers and your toes, and in the little tiny blood vessels that are around your heart, and even those little blood vessels that are in your brain. So small blood vessel changes that are caused by that high blood sugar, that are caused by that hemoglobin A1C, those small changes are something I have a window to look at. And I know what your diabetes is doing. And I can tell your primary care doctor the control is good enough, or the control of the diabetes has to be a little bit better, or the patient is going to end up losing vision, or losing kidney function, or losing sensation in their fingers and their toes. Can diabetes lead to more serious vision issues like cataracts or glaucoma? And the answer to that is yes. Now, do we know that diabetes is directly related to cataract? No, we don't. Cataracts are caused by age, caused by stress to the system. They're caused by things like the things that cause wrinkles. They just happen with age. However, there are some cataracts that are more common in patients that have diabetes. So you can see young patients with diabetes who do have cataract, and we tend to see that more often. So, can glaucoma be related to diabetes? And the answer to that is yes. Because what happens is that hemoglobin A1C again, it damages your blood vessels. But when the blood vessels are damaged and blood supply can't get to tissue well, the eye responds in a unique way. The eye says, hey, I have a big oxygen demand, and we're not getting enough good blood flow in here. And then what are we going to do about that? We're going to make new blood vessels. Unfortunately, the new blood vessels that the eye makes are not healthy blood vessels. They break. And so these new blood vessels can break and they can fill the eye with blood. And that's one type of glaucoma that can occur because blood cells that are leaking from blood vessels don't filter in and out of the eye very well. And you can actually get a buildup of pressure in that way. As well, certain parts of the eye, like the iris, or like the filter in the eye that is located actually where the white part meets the colored part of the eye, those tissues also need a lot of oxygen. And when they don't get it, they grow new blood vessels. And those new blood vessels clog up the filter of the eye. And then fluid can't get out of the eye pressure goes up, and the patient develops glaucoma because that eye pressure ends up causing damage to the patient's optic nerve. So, yes, things that cause problems in the eye filtering fluid cause the eye pressure to go up. That high eye pressure damages the optic nerve, and the condition called glaucoma occurs. Next question. Does gestational diabetes threaten your vision in the same way more permanent forms of diabetes do? The answer is it can, but gestational diabetes is often temporary in nature. And so it causes fluctuations in your vision when that blood sugar causes your lenses to swell. And left really untreated, of course, it can cause changes in your blood vessels as well. But yes, gestational diabetes is a unique type of diabetes that is more transient in nature. Those patients still have to be on the lookout for diabetes coming back and affecting them later in their lives. So, back to gestational diabetes. When a pregnant woman has gestational diabetes, we often advise them, get your blood sugars under good control before coming to get new glasses. Because if the lens swells and it causes changes in your vision, new glasses aren't going to work very well for you. So good control of blood sugar makes it possible for patients with gestational diabetes to actually get a good pair of glasses that's reliable, which is important. You still drive when you're pregnant. So, next question. I know that I have a family history of diabetes. Is there anything I can do to help prevent diabetes and its associated vision issues? Well, of course there is. There are things that I can do to prevent diabetes also, even though I don't have a family history. Some of the things that I do are I watch the diet that I eat. I make sure that I maintain a normal weight so that my pancreas can make enough insulin for the size of my body. Other things that I can do, see my primary care doctor because I need my blood sugar checked. I need my hemoglobin A1C checked if the blood sugar is out of whack or if I have a family history of diabetes. So seeing my primary care doctor allows them to pick up on my risk factors for diabetes, as well as do I have diabetes? And then they can suggest modifications in my lifestyle or diet or things that I can do to either reverse the effects of diabetes or to treat the mild version of diabetes that I currently have before it causes long-lasting effects in my body. Thank you for joining us today on my session about diabetes. I hope I've answered some of your questions, and I hope that I've provided some education so that you can know more about why an eye exam would be important in monitoring diabetes, and how looking at the eye can also have wider implications about what's actually happening with your entire body. Please keep an eye on our Facebook page. We'll be announcing future sessions there in the future, and I really hope that you have a great day. Hope I see you soon in our exam rooms or in the community.